Hello and welcome, everyone. I'm Erin from the Massachusetts Health. Joined today by my colleagues, Emily from MassHealth and Nikki from the Health Connector, who will be today's. Together, we are here to share information about renewing your MassHealth coverage or obtaining coverage through the Health Connector. We'd like to take a moment to thank our community partner organizations and elected officials across the state for their support in promoting this webinar, including our partners in the state legislature and our congressional delegation. Before we get started, just some information about our presentation format. Everyone's audio has been muted and video has been turned off. The presentation portion will last approximately 30 minutes. Then we'll have time for a question and answer period. If you would like to ask a question at any time, please use the Q&A button at the bottom of your screen. We will be monitoring your questions throughout. Please, however, don't share any personal information or private health information when you ask your question, as others on the call are able to see what you write. If you have a personal scenario that you would like to discuss with someone, we will be providing contact information for MassHealth Customer Service and the Health Connector's Customer Service Center, and on how to find help from a local assister. Also, we are recording today's webinar. Following today's session, you'll receive an email with the presentation, so there's no need to take detailed notes. So without further ado, we'll go ahead and get started, and I will pass it over to Nikki.
Thanks, Erin. And again, thank you everyone for joining us today. So everyone has registered for this session. So you know that we are co-hosting a session with our colleagues from MassHealth. And one of the reasons why we're going through this content today is because MassHealth needs to renew coverage for all members to make sure that they're eligible and receive the best benefit that they qualify for. So during the session, you're going to see both staff from MassHealth and the Health Connector. And MassHealth is going to explain, or my colleague Emily is going to explain, what members need to do to update their information and how to renew their MassHealth coverage. And you're going to learn a bit more about this process, but through it, you'll learn that some people may find out that they don't qualify for MassHealth anymore. So I'm going to be stepping through some information about the state's Health Connector and explain how someone can get coverage if they still need coverage and may get help paying for it through the Massachusetts Health Connector. So today's agenda. We're going to explain what a MassHealth renewal is. We're going to discuss why renewals are especially important this upcoming year. We're going to share how you, as a member, can prepare right now for upcoming MassHealth renewals. Prepare you for what you need to do if you get a renewal form in the mail. Talk to you about resources available to help you complete your renewal. And then lastly, at the end, we'll talk about getting coverage through the Health Connector. Now, before we get into the content, the processes, we want to just take a moment and just describe the relationship between MassHealth and the Health Connector. So with that, I'm going to ask my colleague Emily to jump in and just talk a little bit about MassHealth.
Thanks, Nikki. Good afternoon, everyone. So what is MassHealth? MassHealth is Massachusetts State Medicaid and CHIP program, and we provide health benefits and help paying for them to qualifying children, families, seniors, people with disabilities, and individuals living in Massachusetts. We cover quite a few residents of Massachusetts. Our caseload is around 2.3 million right now, which represents about 2 in 3 people in low-income families, 1 in 4 residents of Massachusetts, and 2 in 5 children of all incomes. And what we cover is comparable to most commercial health insurance plans. However, we also cover additional services such as long-term supports and services and certain additional behavioral health services. So I will hand it back to Nikki to explain what the Health Connector is.
Thanks, Emily. So the Health Connector is our state's health insurance exchange. So we're also known as the state's marketplace. So the Health Connector is here to help fill a gap. We came into play in around 2006. And we were here to offer individuals, families, and small employers access to affordable health insurance coverage. So if you are currently a MassHealth member and find that you're transitioning from MassHealth and you don't have access to other health insurance through a job or a partner, other sources, you may in fact qualify for health insurance through the Health Connector. And a lot of people who qualify for Health Connector coverage also qualify for help paying their monthly premium. And some even qualify for $0 connector care plans. Now, during this presentation, we're going to talk a lot about health insurance, but I want to stress that if someone is coming over to the connector for coverage, they can also get dental insurance through the Health Connector. And then lastly, but not relevant to today's presentation, we do have coverage at the Health Connector for employers with less than 50 full-time employees. And that's our Health Connector for Business program. So if there's anyone on here who happens to be interested in Health Connector for Business, certainly that is a different platform, different set of programs, but do go to our website, mahealthconnector.org/business, and you can get more information there. On to the next slide. Emily described what MassHealth is, how it's our state Medicaid program. I described that, the Health Connector is our state's health insurance marketplace. But what we neglected to tell you is that, the Health Connector and MassHealth, although we're separate entities, we have a very close relationship and we share an online application and as well as a paper application. So when a consumer applies for health insurance, and I should specify specifically those who are under 65 years of age, they're using the same application. So there is one application that someone uses to apply for MassHealth, for Health Connector plans, or just to find out if they qualify for any savings through our organizations. And somebody would go to mahealthconnector.org to do that. And we also have a website available in Spanish. The application, has been translated into Spanish if someone wants to log in and access the application in Spanish. So I'm hoping that this level set helps you better understand as Emily goes through and talks to you in much more detail about the MassHealth renewals process and different ways in which you are making changes to your own information or to your own online application. So I'm going to hand the presentation back over to Emily.
Thanks, Nikki. And I just want to, before I jump in, say that while Nikki highlighted that our application and online portal for members under 65 is the same, I will also in my presentation be touching on relevant information for completing renewals and applications for members over 65 as well. So just wanted to make sure you all are aware of that. So first, what is a MassHealth renewal? So federal law requires that MassHealth regularly check whether members are still eligible. We call this check a renewal. Sometimes people talk about it as an annual review. So these renewals occur every year. And what happens when a member is selected for renewal is they receive generally a renewal form in the mail. So renewals happen at the household level. So if you have multiple people in your household that are MassHealth members, they typically receive one renewal form for the entire household. Now, while many members receive renewal forms in the mail, some of them will be automatically renewed. So what this means is that when a member is selected for renewal, first, MassHealth tries to automatically process that renewal by matching the member's information against state and federal data sources. If we find that we do not need any new information, then the member does not need to take any action and they are automatically renewed. However, if we cannot automatically renew a member, we will send a renewal form in the mail in a large blue envelope asking for additional information. It's really important that members respond to those renewal forms because if they do not reply, their coverage may end. Next slide, please. So why, if this is an annual process, why are we talking about renewals this year in particular? So at the beginning of the federal public health emergency associated with COVID-19, the federal government implemented something called continuous coverage requirements. And what this basically meant is that MassHealth and other states put protections in place that prevented MassHealth coverage from ending. And those protections lasted from February of 2020 through March of 2023. And so what's really changing this year is that as of April 1st, those continuous coverage requirements have ended and we are returning to standard eligibility renewal processes. So for many members, this is the first year that there is a risk of losing coverage due to eligibility changes or non-response to renewals. And so all members will need to be renewed by MassHealth to ensure they still qualify for their current benefit. And these renewals are not happening all at once, but are taking place over a 12-month period from April of this year to April of next year. And so this means that members could get their renewal forms in the mail at any time during this 1-year period. So as I mentioned before, MassHealth tries to automatically process renewals by matching the data we have on file against state and federal data sets. There are some populations who may be automatically renewed because they receive their benefits through another service. So just want to call out a few of those who may be automatically renewed in this cycle. Members who receive SSI through the Social Security Administration because they are 65 and older and have limited resources or income, or are disabled and have limited resources or income and receive SSI. Some members who receive temporary assistance of needy families through DTA, members currently or formerly in the custody of some members currently or formerly, in the custody of Department of Children and Family Services and the Department of Youth Services. I do want to say that, however, even if you fall into one of these categories, if you receive a blue envelope in the mail with a call to action from MassHealth, you must respond to ensure that you and the rest of your household continues to receive the best benefits that you're eligible for. And so, as I mentioned previously, this year we're returning to standard eligibility processes. And so what that means is that if you update your MassHealth account with new eligibility related information, so one example of that is you update the level of income that you have, this may cause the benefits for your household to change. They could stay the same, they could increase, decrease, or end. However, generally, MassHealth members can call us at the number listed here, and this will be shared with the materials later, to update their contact information, such as address, without impacting their eligibility. So 2 key things to remember to prepare for renewals. First is to call us to update your contact information. It's really important that we have MassHealth updated contact information so that we can reach you when it's your time for renewal. So please call us to update your address, phone, and email so we can make sure we can reach you with important information. Second is to read all mail that could be from MassHealth. We send mailings that could that have calls to action that you need to complete to maintain your current level of coverage or get the best coverage you qualify for. We're highlighting to look out particularly for a blue envelope that'll have renewal notices with important deadlines to respond by. I also want to note that we send other important mailings in white envelopes, and so that's why we encourage you to read all mail that could be from MassHealth and to respond within the deadlines listed in those mailings. So the blue envelope I mentioned is pictured here. So please look out particularly for a big blue envelope like this that has renewal notice in there. Just a note for folks who are automatically renewed, they may not be receiving a blue envelope in the mail. So how to complete renewal once a member receives that blue envelope, or if they want to renew. So there's a little bit different processes for different member populations. So there's some processes that apply to most members under 65 years old, and others that apply for members over 65 years old residing in the community or of any age receiving nursing facility care, long-term care, or part of our HCBS waivers programs. So starting on the left side of this page, for most members under 65 years old, there's a few ways to complete a renewal. One, which is one of the fastest ways, is to go online to the website listed here and complete that renewal online. The second is to mail back in the renewal forms that a household will receive in a blue envelope to the address listed here, or fax it to the number listed here as well. If you need assistance or want to complete renewal over the phone, please contact our customer service line listed here. There's also an opportunity to schedule an appointment to get help completing a renewal from a MassHealth representative, and we have an online scheduling tool that is linked here. So switching to the right side of the page, which is options for completing renewals for members who are over 65 years old, residing in the community, or of any age receiving long-term care, nursing facility care, or are in an HCBS waiver program. So there's an online submission option, but it's not the same kind of MA login portal that is for under 65. And this is the online option is called e-submission. And so in the blue envelope, there will be a e-submission number, and members can go online and fill out a fillable PDF or upload their renewal. Members can also mail or fax in their renewal forms, call MassHealth and do a renewal over the phone, or schedule an appointment. And please note that most members have 45 days to fill out their renewal forms and send them back to MassHealth. And so if you receive a renewal form in the mail in a big blue envelope, please remember to look at that deadline and to use one of these mechanisms to complete your renewal within that 45-day deadline. So MassHealth has a lot of resources to help support our members in completing their renewals and answering their questions. So the first resource I want to highlight is our MassHealth enrollment centers. And so there are 6 enrollment centers, we call them MECs, across the state, and you can use the link here to find them. And our enrollment centers provide members with a number of types of assistance, including over the phone, virtual, or in-person assistance. And we really encourage members to schedule an appointment ahead of time using this link to spend time with a MassHealth enrollment representative to help them with this process. The second resource I want to highlight is our certified application counselors or navigators. These are community-based resources to help members apply for and renew health insurance benefits. They are trained by MassHealth, but are not MassHealth employees. And they are all certified application counselors and navigators are free services, but they may require an appointment, and that's kind of based on the individual organization, which you can find at the link listed here. And the last resource I want to highlight is our MassHealth customer service line. This is a great place to call if you have questions about your renewal, and the number is listed here. The hours of operation are 8 to 5 p.m. and there is assistance in a number of languages. I will highlight some of the most commonly spoken languages here amongst our members, but we also have translation available in almost any other language a member could need. But there are translation services. I will highlight English, Spanish, Portuguese, Mandarin, Vietnamese, Arabic, and Haitian Creole, among many others. So just want to go over some of the timelines associated with the renewal process. There's a lot of numbers here, so I will try to be as clear as possible. So first, a household is selected for renewal. The first thing MassHealth does is we try to automatically process that member's or that household's renewal by matching their information against state and federal data sets. Now, if we cannot automatically process a member's renewal, we mail them a large blue envelope with a renewal form to complete and return to MassHealth. Typically, members have 45 days to respond to that notice. Members in long-term care facilities have 30 days, and that notice will have a due date on it. So, so members have that 45 days. If a member responds to renewal notice within that time period, and MassHealth identifies that we still need more information from that member, we give them an additional 90 days to respond to that request for information. Now, some members, either because they respond to our renewal notice and are deemed ineligible for MassHealth, or because they do not respond to our renewal notice, may end up being terminated and losing their coverage. Now, if that happens, members will receive a notice at least 14 days before their benefits will stop. For members who lose coverage because they do not respond to our renewal notices, we have something called a reconsideration period. And what this means is that if a member is closed because they do not respond to a renewal notice, they can reach out to MassHealth and provide the needed information. And if they do that within 90 days of being terminated, we will provide them coverage back to the day that they were closed. So this is just giving an opportunity for folks who miss their deadline to provide the necessary information and avoid any gaps in coverage. While the process I highlighted of being selected and receiving that blue envelope is what most members will experience, members can choose to initiate redetermination or renewal before receiving a blue envelope. I do want to note, if a member chooses to initiate a redetermination by providing updated eligibility information, their coverage may change. It may stay the same, but it also may increase, decrease, or end. And any member can elect to redetermine at any time before receiving a blue envelope by providing MassHealth with updated eligibility information. And choosing to be redetermined before receiving a blue envelope will reset that kind of annual renewal clock, meaning that the next renewal will not be due till 12 months from the date of completing that redetermination. I do want to note that if members can update their contact information by calling MassHealth generally without impacting their eligibility, and we really encourage you to do so. So we have updated address and other contact information to reach you with important information about your eligibility and with those renewal notices once a member is selected. MassHealth offers various language and translation supports, which I want to highlight. So we have outreach activities. We have produced flyers, posters, and messaging that is available in 9 languages, including English, Spanish, Portuguese, Haitian Creole, Vietnamese, Khmer, Chinese, Arabic, and Cape Verdean Creole. We're also partnered with an organization called Healthcare for All, which you might hear the local language television and radio station messaging through that partnership that's in various languages. We are also published a vlog incorporating ASL and offer ASL translation during select webinars and online recordings. Members have renewal forms mailed in either English or Spanish, and they can also request those renewal forms in large print or Braille, and encourage members to call our customer service line if they need translation of any renewal forms. We also have, as I mentioned before, our contact center has interpreter services for almost any language a member may need. We also are certified application counselors, have various abilities to speak other languages, and we have a list of what languages are spoken at those different organizations. And we also want to highlight that for members who use ASL, we offer on-demand VRI in person at our MassHealth enrollment centers. So we want to acknowledge that some members who complete their renewal may no longer qualify for MassHealth, but there are other affordable coverage options for members. And so first, what's really important is that even if you think you are no longer eligible for MassHealth, you should still complete your renewal, because it can help MassHealth determine other affordable healthcare options, such as the Health Connector. And also, sometimes there's situations where, let's say, a parent may no longer be eligible, but their child may still be eligible for MassHealth. And so for members under 65, one affordable option that we want to highlight, which our friends at the Health Connector here will go into more detail, is options through the Health Connector. And losing MassHealth is a qualifying life event, which allows members to enroll outside of the regular open enrollment period. For members over 65, there are some other options for coverage, including Medicare, and the fact that members may still qualify for the Medicare Shared Savings Program. And MassHealth, losing MassHealth qualifies for a special enrollment period through Medicare outside of standard enrollment periods. There are also a number of other waiver programs and prescription advantage programs that may help provide certain programs for members who lose MassHealth coverage. We have published what we're calling a MassHealth Renewal Help Guide, and you can find that online. And this really has step-by-step instructions of how to create online login accounts, the timelines that I've mentioned, where to go for help, whether that be the enrollment centers or the certified application counselors, and includes some frequently asked questions and other helpful information. We have a website that is dedicated to renewals, and encourage you all to look there. It has more information about how to complete renewals. It has access to those posters and flyers that I mentioned earlier, and also links to that renewal guide on the previous page. So just final tips. If you are under 65, the fastest and easiest way to renew your coverage is online and creating a login account. And if you are over 65, we point you to this link here, mass.gov/MassHealthSACA, to find out the best ways to renew your coverage. Remember to call MassHealth to update your contact information and make sure we have the most updated address on file. And just want to say, that due to the large number of renewals, there may be some longer than usual hold times at our customer service center, but we really do our best to keep that line, those hold times low. And just remember that the whole renewal process is over a 12-month period. So to be on the lookout for your renewal forms from now until April of 2024. And lastly, please go use our resources that I've listed to get help with this process. We know it can be confusing. And so we encourage you all to use our MassHealth enrollment centers, customer service centers, and certified application counselors and navigators to ensure that you can have the assistance you need to complete your renewal to ensure you keep the best benefit you're qualified for. So I will turn it over now to the Health Connector side.
Thanks so much, Emily. Still clicking on buttons. Before I dive into the slides, I think I just want to check in with Erin to see if there were any questions that we needed to or should answer at this point.
Sure. So I've received a number of questions. I will hold on to some of them because I think they'll pertain more to your content, Nikki. But two questions that I received that I think would just be helpful before we move along. Emily, you'd referenced going on to the Health Connector website to update information. And I think, Nikki, you'll be able to jump in here too. But what would you recommend an individual do if they go to create an account or log into an account and they receive a message that says they're not able to proceed because maybe someone they're applying with already has an account? What would the next steps be for that person?
Emily, I can jump in with this if that's helpful. Because I think the best thing for someone to do if they're having any difficulty with their online account, you should call customer service. And honestly, you can call either MassHealth customer service or Health Connector customer service, and they will be able to assist you. Yes, it's unfortunately sometimes this happens. And I think the thing we really want to stress for people is if you're having any difficulty, you don't want to try to create a whole new account. No, absolutely not. If you have submitted an application before, you really want to access that application and make any changes that you need to make. It's going to be a lot faster for you. And the system has been programmed to actually try to stop people from duplicating an application if they've already got one. So that's one of the reasons why you might be running into errors.
Great, thank you so much. And just one final question before we move forward. And again, we'll take those other questions at the end. But Emily, you mentioned the over 65 population. So if individuals have Medicare as well as MassHealth, can they expect to be going through this renewal process and keep an eye out for that blue envelope?
Yes. So the renewal process kind of applies to all of our members, including those who have both MassHealth and Medicare. Please look out for a blue envelope that'll have a SACA, which is what we call it, related renewal form, which you will need to complete.
Great, thanks so much. So I'll hand it back to you, Nikki, and we'll see you shortly.
Great, thanks, Erin. All right, so let's get into getting coverage through the Health Connector. So going on to the next slide, I already told you a little bit about our organization and that we're here to provide access to health insurance coverage if someone isn't able to get it from another source. Emily mentioned that if someone loses access to MassHealth coverage, it's considered a qualifying life event. And you might be wondering, okay, why does this matter? And that's because when somebody has a qualifying life event, it provides them with a special enrollment period that lets someone either enroll in or change health insurance plans, regardless of the time of year. So typically with health insurance, there are open and closed enrollment periods. But if you lose access to coverage, in this instance, if you're losing access to MassHealth, it is considered a qualifying event, giving you a special enrollment period. So other things that let someone qualify could include a change in household size, your income going up or down, a change to someone's immigration status, or even if someone's moving either into Massachusetts or from one part of Massachusetts to another. You'll also see listed here things like getting married, having a baby, adopting a baby, or even losing employer-sponsored insurance. There is a complete list of all these qualifying life events on our website, but I think you get the gist of what this means. But when you are in the special enrollment period, you still, if you owe a payment and there are enrollment deadlines, and we'll talk more about them, all of those things still apply. It basically just opens your window so that you can qualify to enroll into coverage. On to the next slide. I wanted to just spend a little bit of time talking about getting health insurance coverage through a job. So if someone's working, you might be eligible for benefits through your employer. So if you were previously on MassHealth, you might not have even been thinking about this, but if you are employed, you might want to speak to the Human Resources Office, the Benefits Department, and just find out if you are eligible for benefits for you or your family. And then, of course, you want to get information about the cost of those plans, how much the employer will be contributing, how much you would need to contribute, and also when you would need to make a final decision to enroll in that employer-sponsored health insurance. It is really important to note that if someone has the option or access to affordable health insurance coverage through an employer, they are not going to be eligible for financial help through the Health Connector. But we also want to note that there are instances where the coverage offered by the employer may not seem affordable to you, the member. So it is true that Health Connector plans and savings could be available if you don't have access to affordable health insurance coverage as outlined by our state's affordability standards. So in order to figure that out, we're going to need to collect some pretty detailed information about the plan that is being offered to you, and then of course the cost. So there's a link on this page that will take you to a worksheet. And that worksheet is something that you would have to, go to your employer, go to your benefits department, have them help you gather this information. It's not going to be something anyone's going to know off the top of their head. But these questions are going to need to input these figures into the application, whether you are completing the application online or even if somebody's doing something via paper. And it's going to help our system determine whether or not you and your family could be eligible for savings through the Health Connector, because that employer's insurance might be unaffordable to you. On to the next slide. Let's talk just really broadly about Health Connector plans. So super high level here. I just want to acknowledge that any health insurance plan, or actually any health or dental plan that's sold through the connector, meets federal and state standards for coverage. So these are known as qualified health and qualified dental plans. And depending on where you live in Massachusetts, you're going to be able to choose from a variety of plans specific to your area from leading insurance companies in Massachusetts. Now, there are two types of plans and savings available to people that you can only get if you come through the Health Connector. And that is health plans with advanced premium tax credits. And people can qualify for those tax credits, and those will help reduce the cost of monthly premiums. Or people qualify for a program, again, unique to coming through the Health Connector for coverage. The program is called Connector Care. And this is for folks who are in lower income ranges, who meet other eligibility requirements, and you could qualify for low or no cost comprehensive health insurance coverage. Now, onto the next slide. I'm going to describe this in just a little bit more detail, because this could be the very first time you're hearing about these programs. So these are two ways you could get help paying for coverage through the Health Connector. So advanced premium tax credits, if you qualify, what that does is it lowers the premium amount you pay each month as a member. The IRS is going to send your federal tax credit directly to the insurance company. You, as the member, you just pay less each month. And then you get to make a decision about the amount of the tax credit that you want to apply to your monthly premium, but you've got to make that decision. I mean, you can change that decision throughout the year, but typically you make that decision up front, and you can choose to apply some of your tax credit or all of your tax credit. Now, the other program, the Connected Care program, the way in which you are offered savings is a combination of these advanced premium tax credits plus additional state dollars. Those two together reduce the premium amount you pay each month. Now, the Connected Care program, I mentioned, it's a comprehensive program. There's low monthly premiums, low out-of-pocket costs, no deductibles, and depending on the plan type you qualify for, you could choose from a plan as low as $0 a month or even $137 a month. And we'll show you, we'll talk a little bit about getting an estimate so you can see what it is you could in fact qualify for. Now, I've been talking about getting financial help to reduce your monthly premium. So I've said already that we are the only place where you can access state and federal savings. And if you're eligible for the Connected Care program, I just want to show you an example of what you could in fact be paying for these low monthly premiums. So again, depending on your household and your annual household income, you could qualify for a $0 plan, a $48, $93, or a plan as low as $137. There are other plans that are more expensive, but again, you have to make a few decisions to determine which plan in fact you want to enroll in. On to the next slide. Okay, in terms of applying, there are 3 ways to apply or update your application. Emily has talked about this, and I've said, for those of you who are under 65, you would want to go to mahealthconnector.org or the Spanish version of our website. You could contact our customer service centers by phone, or you could go get some help from a community partner organization. Now, that help is all free. I just want you to acknowledge this is a lot of free resources are available to you. And one application to find out whether or not you qualify for coverage through the Health Connector or for MassHealth. Now, because our organizations share this online application, we actually need to we're legally required to send you letters from both the Health Connector and MassHealth. So I just want to say that up front so that not to cause confusion for you, but if you do not qualify for MassHealth, you do qualify for the Health Connector, you will get 2 letters. One from the Health Connector saying you qualify for coverage with us, another from MassHealth saying no to MassHealth. All right, so I talked about getting free help. Free help is available through customer service. The number is listed here, 877-623-6765. If someone needs TTY or is deaf, hard of hearing, speech disabled, we do have assistance for you. The TTY number is 877-623-7773. If you go to our website, you can get the complete list of hours of operation for our call center. We're typically open 8 through 6 from Monday through Friday. You can also get help at local events. So if you, when you get this presentation, you want to click on this link, or you can even go to our website and look for upcoming Health Connector events, and you can get free help at these events as well. And Emily talked about this, but I just want to drive it home again. Community partners. There are people in the field who have been trained and certified by MassHealth and the Health Connector, and those folks are known as navigators or certified application counselors. They can help you with every aspect of this process. And you can even find help in a language other than English if you need it by going to our website, and you can search for help near you or help in a particular language. Now, just in terms of key takeaways from the Health Connector, Emily spoke about MassHealth, their renewals process for people who are under 65 as well as people who are over 65. Now, I just want to point out that if someone lost access to MassHealth coverage and still needs health and dental insurance, and they don't have another way of getting coverage, so not through a spouse, employer, a partner, etc., they can look to the Health Connector. Now, what is the first thing you should do? Emily said this, I'm just going to say it in a different way. Update your application, find out what plans you qualify for, and if there are additional savings available to you. Now, the Health Connector, is separate organization from MassHealth, but we share an application with MassHealth, and we offer coverage for individuals, families, and small employers. And we do have some deadlines. So if you are looking for coverage to start on the first of a particular month, so in this example, if you're looking for coverage to start on July 1, you're going to need to apply or update your application, pick your plan, enroll, and if you owe a premium, pay that by the 23rd of the month before your coverage can start. You can apply and get help online, over the phone, through a local assister, or attend a local enrollment event. And again, all of this help is free, and people can help you update your application, apply for coverage, choose a plan through customer service. So truthfully, just want to encourage you to call today, make an appointment if you need, particular help. So with that, Erin, love to turn back to answer some questions. I feel like there was one in particular that popped up about someone losing access to employer-sponsored insurance. So I don't know if we want to just start there.
Go right ahead, Nikki. We do have a few questions kind of similar to that. Outside of this renewals and redeterminations process, the role that MassHealth and the Health Connector can play for individuals who maybe are moving to the state, are moving from their job, whether they're going out on their own or whatnot, or maybe just losing coverage from an employer. So anything, Nikki, you'd like to add there?
Why don't I start with someone losing access to coverage, whether they're if someone is losing access to employer-sponsored insurance, if somebody is losing access to MassHealth coverage, that is considered, losing access to coverage is considered a qualifying life event, and it does open a special enrollment period. So when I was describing that earlier, this special enrollment period isn't specific to just people losing access to MassHealth. If someone needs access to coverage, come to the Health Connector, see what it is, see what you might qualify for. If you're looking for help paying for that coverage, complete the online application and see what savings could be available to you. Now I want to turn to my colleague Emily to help with the other parts, because I've already forgotten what the other parts of your question were, Erin.
Yeah,
Emily,
so
if you can help.
Yeah, so the losing the employer-sponsored coverage, but what about somebody who is moving to the state? Outside of the renewals and redetermination process, just what a person should do if they're moving to the state, and what are the timelines? Actually, another question just came up as we were exploring this. What are the timelines people should keep in mind if they are a new resident, or say they are losing their employer-sponsored coverage, because I know there are timelines associated with both.
Yeah, so thank you for the question. MassHealth, unlike the Health Connector, does not have an open enrollment period, which means that new applicants can apply for MassHealth at any time in the year. And so if there is a change of coverage, if you lose coverage, if you're moving to the state, you can apply to MassHealth at any time. If you have questions about any sort of particular timing related to your situation and when one coverage may end, I encourage you to contact our MassHealth customer service line for kind of individual related timeline questions. But please apply whenever you think you may be eligible and need coverage.
And so just to add on to what Emily said, there are some deadlines and some restrictions for people accessing Health Connector coverage, but we always say to anyone, if you need coverage, you don't have access to it, just apply right away, because you don't exactly know what you're going to qualify for. So, and if you lost access to ESI, typically you need to do that within 60 days of that event happening. But if somebody, let's say, is moving to Massachusetts, you could, in fact, apply when you get to Massachusetts, or you could apply in advance of moving to Massachusetts. Again, it's 60, that's in order for someone to gain access because they're moving into Massachusetts to Health Connector coverage, you really need to take action within 60 days. I hope that helps. But essentially, what Emily and I are both saying is apply as soon as possible, because you don't know exactly what it is you're going to qualify for.
Great, thank you. And now I'll ask this question to Emily, because it is about the blue envelopes. And what can a person expect to find in their blue envelope?
Yeah, so there is some difference depending on, the division I talked about earlier of under and over 65, and also some special populations. But generally, members will see a cover letter that'll explain how to submit the renewal, what it is. There'll be a renewal form that they will need to fill out. There'll be some information called a babble sheet, which is basically just listing in a number of non-English languages how to get support if a member needs translation or other language assistance. And so those are kind of the main things to look out for in those renewal packets. And what those look like may change slightly based on kind of the particular member circumstance.
Great, and I will keep you on this topic just as we talk about the blue envelope and the renewal process. And if somebody is going to be working with someone to complete the renewal process, how quickly will they find out if they remain eligible for MassHealth, or if they become eligible for the connector or otherwise? What is that turnaround time like, or what can they expect?
Yeah, so the turnaround time is going to vary depending on the kind of the mechanism somebody uses to complete the renewal. So for example, if somebody has an MA login account and is under 65 and completes the renewal online, they'll typically find out more quickly the result of that renewal. That's compared to if somebody mails in a completed renewal form, there is some additional processing time. But I think the important thing to know is that when in that processing window, if your renewal is being processed, you will not lose coverage because of that processing time. And as I said previously, if for some reason, if you are deemed ineligible or did not respond and are going to have your case closed or be terminated, you're going to receive a notice at least 14 days in advance before that coverage stops. So you have an opportunity to start action to prevent gaps in coverage.
Right. Now, this is a bit of a specific question, but I hope it's just a quick and easy answer. So if somebody's going through the renewal process, and right now they're 65 and they're about to complete it, but within a few months they'll be they're 64, they're about to be 65. Should they complete it as they are the dates that they are completing it, or should they be more prospective thinking?
So I would say complete whatever you have been set now. And when you need to, there is a different process for when you turn 65. So that's very good for folks to know, and that there's a new application that they are going to have to fill out. But we mail that in advance of that 65th birthday. So I'd say complete the renewal that you are sent now to ensure that you have no gaps in coverage and you maintain the best benefit you're eligible for. However, as your 65th birthday approaches, you will need to complete a new application. If you have questions about that or questions about the best way to do that, please reach out to our customer service center or make an appointment at one of our MassHealth enrollment centers.
Great, thank you. And now I will turn it to Nikki for some kind of income related questions. But of course, Emily, feel free to jump in. So as somebody is calculating their income, what should they take into consideration if their income is fluctuating, they're not certain what it will be over the course of the year, whether they take on odd jobs, seasonal employment, what have you? What would you recommend?
Sure. I just posted, and I just want to let everyone know I posted a link to more detailed information about income on our website. But I generally, what I would say is that when you're completing the application, you're asked about your current income as well as your estimated income for the whole year. So when you're thinking about, this entire, year, what this could look like, and your income could go up or down, what you want to do is look at, what has happened, what have you made essentially from January through June? And then what do you think you're going to make from, June until the rest of the calendar year? And for some people, some people may be landscaping in the spring, summer, fall, have time off in the winter, they're not plowing, they're not, it's people create their whole income using a variety of different sources. So we need you to give your best estimate. Sometimes we'll look to last year's tax returns to kind of see that generally we made this, if it looks like it's a similar year. But I think the most important thing to note is that if your income does fluctuate and it goes up or down, or it changes in a way that you weren't expecting, you can always come to the application or call customer service, either MassHealth or Health Connector, and just update your income. So you can go in on your own or contact us to update it. Now, the reason why it's important to update your income is because if you are a Health Connector member and you're getting advanced premium tax credits based on a particular income, and then your income actually went up, you're going to, when at tax time, you need to reconcile your tax credits. So some people have been in a position where they actually need to pay some dollars back that they were given. And then there have been other people who've been in the really fortunate position of getting more dollars at tax time than they expected. So that's why it's super important when you're completing this application to make sure you're keeping your income as close to true as you are aware of.
Great. And you kind of answered another question there about the importance of updating income and what would happen if your income was over what was originally estimated. Recognizing we're getting close to time, I want to ask a question just generally about COBRA coverage, and if individuals who are offered COBRA through their employer can actually shop for coverage through the Health Connector, or do they have to take COBRA?
That is a great question, and the short answer is no, they do not have to take COBRA. COBRA is an option. COBRA typically is quite expensive or very surprising. There's a surprising sticker shock for people when they see what the full cost of their employer-sponsored insurance is. So before somebody enrolls into COBRA, I would definitely encourage them to come to mahealthconnector.org and look to see what your options could be on a different plan, different network. So perhaps there could be some savings there.
Excellent. And for individuals, married couples who may have different circumstances, whether it's their income, coverage needs, etc., should they be applying separately, or what are the requirements there?
I'll start this, but Emily, certainly feel free to chime in. Because typically we say, from the Health Connector's perspective, we're thinking about your whole, your tax filing household. So if someone is part of your tax return, we want to know about them on the application. And it doesn't matter from our perspective if, let's say someone, you need health insurance coverage, you have a spouse who is disabled and they're already on MassHealth. we want you to include that person on the application, but we want you to say they don't need coverage because they have access to MassHealth, right? So when we're looking, we're trying to get a really good picture of what your household looks like so that this application can assess the best savings that can be provided to you, the best plans that can be provided to you. Emily, I hope you can add more to that.
No, I think you really covered it. Yeah, please include everyone in the household. Just so you know, there are members where there are households that some members are on MassHealth and other members of that household are on the connector. And so there's a lot of different permutations about how different coverage may land.
Great. Well, thank you so much, Nikki and Emily, for going through all of that important information, for answering these questions. I know there are some questions that we didn't get to, but we are just after 1 o'clock. So again, for those specific questions, specific questions about going through the renewal process or getting help applying for coverage, we would encourage you to contact the call centers. And that information will be in the presentation as well as it's in the chat. And for other general questions, we will be certain to cover those and send answers around with the presentation in an email at some point this week. But thank you so much for joining us today. And Nikki, Emily, anything you want to leave our attendees with?
No, just thank you for joining us, and we just appreciate your questions and your engagement.
Great. Well, thank you so much all. Take care.